life and home to diverse peoples and cultures.
It key players to fashion out ways to diversify its economy.
We focus, among others, on education, health, agriculture, politics, environmental issues, and remote development.
Rstv.
We traverse the region for development.
Good afternoon and welcome to another exciting edition of Challenge Diaries. From setback to comeback. You know that we're talking about on this program. What are those challenges you've been through? Have you been falling? Have you been down? Have you experienced certain things that you feel you cannot do them again? That's why we're talking about setback to comeback. This is Challenge Diaries. We challenge ourselves. We want to strive more, we want to do more, we want to give in our best. Nothing should put us down. I don't know if you have any of those challenges and you feel that you've come to the end of the road. Yes, on this program you have not come to the end of the road, because if it's health matters, we have the result, we have the solutions. Whatever it is that you are done with or you think that you want to talk about, Challenge Diaries is always here for you. So why don't you follow us as we do this right together. And today I'll be talking again on health issues. Like I said, health is wealth. If you have health, you are wealthy. Because if you are sickly, if you don't have health, you are poor, because all of your funds, everything you work for, will go into medications. But we are here to give you the right diet, how you should manage your health, what you should do, how what you should know. Challenge Diaries is here to inform, educate, and entertain you in every way of the world. So why don't you ride with me today? And I'll be talking to one of the renowned doctors in town that you will wish you were here with me. But don't worry, if you're at home, you can always get us, because I want to give you the link to watch this program. My name is Beauty Benjamin on Challenge Diaries, and today I'll be talking to Dr. APPOLUS JOSIAH, pediatrician and head of the Department of Pediatrics, River State University Teaching Hospital. It's grounded in the business, in the medical business. He knows about it, he knows his onion. And so today we'll be looking at gene therapy for sickle cell patients. Now, if you are there, if you know someone who knows someone, or if you are that person, if you're a warrior out there, that's what they call themselves now, I want to tell you to quickly tune in. Tell someone to log on to GoTV this minute, because everything you need to know. You know, people think sickle cell is a death sentence. People think sickle cell is a kind of myth that surrounds it. Maybe it's a curse. It's a sickness that drains your blood. It's a sickness that kills you. People say there's a myth that you cannot clock the age of 9 or the age of 6, the age of 10, 18, and 20. But I have seen someone who is 70. A lot. If you may know, Adekunle Gold, Adekunle, it's one of the warriors, and he's thriving and doing very well. All you need to know is to be informed, know the right thing to do. If you already have a patient or someone who will have sickle cell, there is a solution. Whatever, is it prevention, is it cure, is it management? But today we are basically going to look at gene therapy. Gene therapy is a new one that we're looking at now. You know, we've been faced with bone marrow transplants for sickle cell patients. But recently we've come across the 31st of January this year, the UK also released a gene therapy. It says it can actually cure you permanently, just like the bone marrow when done with. But I am not in the medical field, that's why I brought someone who is that with the situation and everything that we need to know. So come with me, let's meet my guest this afternoon, Dr. JOSIAH. You're welcome to Challenge Diaries.
Thank you very much. Thank you.
It's good to have you here.
Thank you. You're welcome.
So what are you eating? I can see all the hairs, they're turning gray. I also have gray on my head too.
Really? You are not showing it.
Is it because I've colored them? You know, I colored them.
You are not showing it.
Okay.
You are trying to paint it. No color paint.
But I'm a woman.
It's okay.
So I'm trying to make it stylish.
Stylish.
Yes.
Okay. For us, it's evidence of money, right?
And that's why I said you should give me a bottle of wine to show this evidence. Do you understand? Let me follow you in this money.
All right.
Doctor, you're welcome to the program now.
Thank you.
Now, let's maybe briefly tell us about sickle cell for the benefits of those who are watching. They would like to know. You know, I'm sure I've had you on the program, the mirror with it to Benjamin, to talk about it, but that's some years back now. Let's refresh the minds of our viewer out there, what sickle cell, how they get sickle cell, and how to prevent. Now we'll now go into the treatments and management of it, because today we are supposed to center around gene therapy, but we cannot jump the other ones to get to gene therapy. So let's start. What is sickle cell?
All right, so thank you very much, and viewers. Sickle cell is a condition that is inherited from parents, and that means the parents will be carriers of the gene. What defines who you are, your nature and everything is the gene you inherit from your parents.
Okay.
And for one to have sickle cell disease or sickle cell anemia, has to receive a gene that is a carrier from the mother and a carrier from the father.
Okay.
So to produce a child with sickle cell, then the patients, both of them will have to be carriers. That's AS genotype. Remember, the common sickle cell that we are talking about here is SS genotype. We know we have the SC genotype, but the major one that a lot of our people here so far is the SS genotype. And for you to have that, you receive AS from the mother, AS from the father. That is it. So a marriage of two people who are AS may give rise to a child with sickle cell SS.
Okay, I like the word may give, which means
yes, may give.
There are possibilities that you may not also get.
No, yes, there is a possibility that you may not get, because you require 1 in 4 chance. That is, you have a 1 in 4 chance of getting sickle cell when there is a marriage between an AS person and AS person for each pregnancy.
Okay.
So it's like putting 4 pigs. Maybe you write AS in a bottle, and you close the eyes and you just do a blind dip. Pick one, and then you check whatever thing you get. So there is a 25%. That's 1 in 4 chances of having a child with sickle cell from every pregnancy. Not all the pregnancies put together. So each time the woman is getting pregnant, there is a possibility, 25% chance that that baby is going to be SS.
Okay.
So there is a possibility of that baby is going to be AA, and there is a possibility that that child is going to be AS. 50% chances of that. But that is a marriage between an AS person and an AS person.
Okay.
Imagine that an AS person is getting married to an SS person.
Wow.
The odds towards sickle cell tremendously increased. So you have only 1 in 4 chances of having a baby that is AS. The rest,
but
the
that
patient
is
going to
advisable.
be SS.
It's not advisable.
It's not advisable. It's not something that should be considered at all.
Okay.
It's not something to be tried, because imagine you have sickle cell and you are managing yourself. You are struggling to manage yourself, and you are now going to produce children that have sickle cell. With your own sickle cell, you will struggle to manage another person with sickle cell. That's double tragedy.
Does it mean that the AS person is potentially a carrier? You know, they said AS, they are
AS is a carrier.
It's a carrier.
That is the state. Yes.
It's a carrier.
Yes.
Okay, but does not manifest.
No, it doesn't manifest except under very stringent, strict stress.
Okay.
Yes, it can have a little sickle and have some pain for the person that is AS. That is very severe conditions.
Okay.
Otherwise, it's normal.
Now let's look at it where we have people already married, and there's a conception and there's a baby. Now, is it possible to determine the genotype of the baby while in the womb at the early stage?
Yes, absolutely.
Okay.
You can do the genotype of a baby while the woman is pregnant.
From how many months?
From 13 weeks.
13 weeks.
Yes. Between 9 and 13 weeks, you can do the genotype of the baby. What you do is that you do what we call chorionic villus sampling, where the pregnant woman, under ultrasound guidance, a needle is passed and a sample from the baby's blood is taken, and then they send baby is still intact.
Nothing happens to
the baby.
Not in danger.
No, well, for you to invade that place, there's a tiny risk. But those risks are usually very calculated so that it is very minimal.
Okay.
So that's why it is done by specialists, not just anybody.
Okay.
So the sample is taken, is analyzed, and if the child has whatever the genotype of the child, you will know it. So when you know the genotype, you determine if it is AA, for example, that's excellent. If it is AS, fine. But if it is SS, it's now left for you to determine what do you want to do with the pregnancy. Do you want to consider, do you want to continue the pregnancy? Do you want to end the pregnancy? It's strictly your choice.
Okay.
So you decide what you want to do at that point.
Okay.
But it can, that diagnosis can be done.
Okay, now there's a lot of like when I was introducing the program, a lot of people think that sickle cell is a death sentence. They think that it's a kind of problem that is spiritual. That is like in our local term, this is Najuju, this is Nobanje, and all that, because you don't know. Do you think anyone in that particular state is under death? Is it like your life threatening?
Yes, sickle cell is not a death sentence. We've said time and time again. But sickle cell is not a spiritual anything. It is purely physical and medical. And then because most of the time those who have this sickle cell, some of them know before time, before they engage in it, while others don't know. It's along the line they discover it. So sickle cell is not a death sentence. Sickle cell is not even a guarantee that someone is going to die, because there are a lot of sickle cell patients that have lived very long. Like you did in your intro, you said people have lived up to 70 years.
Yes.
The oldest person that has lived with sickle cell has lived with sickle cell for 96 years. And he's a Nigerian, he's not from another country.
Yes.
Yeah, so that lady lived that long and died with sickle cell. And there are many other people too who have lived with sickle cell for several years. That's several decades, and have died at pretty old age.
Okay.
So it's not a death sentence. It depends on how the individual manages himself, when the diagnosis was done, and the health-seeking behavior of the parents or the individual, if it's an adult. You know, so those are the things that determine the outcome in the sickle cell, and even the cost, the financial capability of the parents.
Okay, let's come down. Before we go to the gene therapy now, let's come down to management of this, sickle cell patients. How do we carefully manage them?
Yes, like you said, sickle cell does not have a simple cure like that. And so any illness that is a chronic illness is managed. And the manage is to take care, having an understanding of the basics for this sickle cell, and then to take care of those basic needs. In sickle cell is that the cells which are supposed to be round in shape, they happen to be C in shape, and they can easily be destroyed. The body recognizes those cells as abnormal because they are not the normal cell, and the body destroys it. When they destroy these cells, the person's blood level goes down, and because these cells are C-shaped, they tend to block the tiny blood vessels in the body and cause severe pain for the individual. So if the individual understands the condition very well, the major things that you do in management include managing the pain and then taking drugs. And one of the ways to prevent the pain is taking lots and lots of water, because it means that the blood is thicker, the person is dehydrated, and then the blood vessels are blocked, causing severe pain in the individual. But if the person takes lots of water, it frees the blood vessels, and then the person doesn't have that crisis. And there are other medications that are taken for to help to build up the blood, because when this blood is destroyed, you need to replace it.
Yeah.
Because it's the blood that carries oxygen around the body and helps you to stay alive the way you ought to stay alive. And to do this, you will need to take hematinics, what we call blood multivitamins, like the multivitamins, the folic acid, and then because malaria infections are conditions that can easily trigger the crisis, you want to minimize those drugs, those conditions. So you take malaria prevention, like using paludrin. You also take treatments like taking antibiotics, like for children we give them penicillin V, that helps to protect them against frequent severe infections. And these patients are also advised to take, beyond the routine immunizations that children take, we advise them to take other immunizations, like immunization against meningitis, immunization against sickle cell, against typhoid, immunizations against pneumonia.
But those ones, I'm sure they take that one from their infant age.
Yes, they do take it, but you know, there is an extra that they have to take beyond what the general public takes. So they have to take it. So we counsel them from the beginning to take those vaccines to help prevent severe crisis of meningitis, bone infections, pneumonia, and all of those. These are the things that eventually kill them.
But one thing I also know that we need to talk about is managing these patients at home. A lot of time people will say, I don't have money. You are coming from the government hospital. Now, do you think a parent or a caregiver should manage these people at home?
Yeah, because of the unpredictable nature of sickle cell and the pain, it can come up at any time. And you can be in a place where you really cannot just have access to the doctor immediately, and the pain is excruciating. We counsel our patients on how to manage themselves, the initial management at home. Like we tell you, drink lots of water, warm water preferably, and then take pain relievers. We tell them take Panadol, take ibuprofen. Those drugs must be in the house at every point in time. So you take those ones. So if the patient is taking those medications and the pain persists, you head to the hospital. Don't try to manage a lot of things. And meanwhile, they are on these medications we talked about, the multivitamin, the folic acid, the paludrin, the penicillin V, and then most recently, drugs that modify the illness, such as hydroxyurea. They are taking it every day. So on a regular basis, the patient is on medications every day. And so this is part of the management of the condition. So these are treatments you take at home. But the pain relief, which is the major thing, is something you take at home, take lots of water at home, and then head to the hospital. It is something we advocate, but not to overdo it.
Okay, viewer, I hope you have been following. We had to give you a little brief of what sickle cell is like, what you have to do for management, how you can prevent it, and all that. We talk about it now. Maybe later on you will touch, are there foods that these people cannot eat or can eat, or exercise and all that. All of these things are part of the healthy living. But now let us go to the topic for the day, which is why we are here now. Gene therapy. Doctor, I saw this. I followed up this thing last year. Now I know of the bone marrow, which was the one we all know about, bone marrow transplants. And then suddenly I opened up one day and I saw gene therapy, and I read through. I'm like, I don't understand. And in all these things, there are money. And I said, okay, who's best to explain to us what is this gene therapy? Is it better than bone marrow, or is it what? How does it work? Because we know that bone marrow, you need someone to get the marrow who you're conversant with, whatever. Now, gene therapy is saying, no, I don't understand. So that's why I want to ask about what is gene therapy as regards to sickle cell.
All right, so gene therapy is one of those modes of management or treatments that is supposed to provide cure for sickle cell disease. Gene therapy is not just for sickle cell. Okay. It is for many other conditions. It's the reason why we are having hope for cure for many diseases, even including diabetes and other disease conditions. Because what is the idea about the gene therapy? The idea about gene therapy is that there is a problem somewhere. There are some genetically inherited illnesses that you are born with.
Yeah.
And these are because the gene, which is what codes, which gives instruction to what you become, how you live your life and everything, how you look, even your height and everything about you, is encoded in the gene. Now, mistakes are happening. In sickle cell, there is a mistake somewhere, such that instead of the AA gene, you have the S gene. And somewhere along the line, you have an interchange of amino acids somewhere along the line. So when this happens, it's because the gene has a mistake. So the treatment for the gene therapy is about removing that thing that is abnormal and putting the correct thing. So that is
in a true surgical means, right?
Yeah, well, it is so you can say it is surgical, but what we do is a surgical process. But what we do is not like, oh, there's somewhere you go and use knife and cut and then fix in something. How it is done is this: the person's blood is taken. The person's blood and the DNA is analyzed, and you identify where the mistake is taken. The abnormality is identified.
Okay.
You use means of technology, using of some carriers like viruses and other, to cut the abnormal gene.
Okay.
You cut it off and use that same technology to cut the original one, the correct thing, and bring back and insert it into where the other gene was removed.
Okay.
When you have inserted it into it, you incorporate this correction that you have made in the gene. You incorporate it into the cell of the individual and multiply it. So you do all this outside the person's body.
Okay.
You analyze it, it's in a lab, you pick the gene, you isolate the cells that have this gene, and you remove the bad part, and you bring this correction and fix it. Once you have fixed this thing inside, you now multiply that cell. When you multiply the cell inside that individual, multiply it into many, you now transfuse the person back, just like what you do in bone marrow transplant.
Okay.
So you kill all the cells in the person's body, and when you have killed all the bone marrow, that is the bone marrow of the person, you have killed all the bone marrow of the person is on admission and is on life support, that is receiving all the support that the person needs. And then you now transfuse this blood that you have multiplied the gene you have corrected, you have multiplied, there are cells that you impute it into. You now tell the cell multiply, the cells multiply with the corrected gene.
Yeah.
So you now transfuse it into the person, just like the regular blood transfusion that you do. These cells will go to the bone marrow where all the the bad cells have been removed. All these ones that give rise to the sickle cell. You have cleared that system, and you now planted this one. You now plant these new cells that carry the correct gene, either the AS gene or the AA gene. You implant it there, and once you implant it into the bone marrow and it grows, you give it some time. Once it grows, all the cells that will emanate from the bone marrow subsequently will be producing AA cells. So the person is no longer, so like you have reconditioned the person that was used to producing, SS cells now produces AA cells or AS, depending on the correction that you have done, but mostly it is the AA cells, and the person is cured. Once that thing happens, and the person's bone marrow can on its own produce AA cells without producing the SS cells, the person is cured.
How do you rate this? Over 100?
It is still as at now, it is at the level of research. They have not authenticated it and said that it is the perfect treatment for everybody. They are still researching to identify the risk. Remember that what we call cancer has to do with gene modification. the gene is changed and the person's cell now start producing rubbish cells in the person's body. That is what cancer is, producing rubbish, useless cells in the body. And we are talking about this gene therapy is a means of instructing the cell not to produce what it's supposed to produce, but to produce what you are directing it to produce. And the possibility is that this thing, when you put inside the person, may now go out of control and now start producing useless cells too. So they are weighing and researching on, is there this possibility? How do we mitigate these possibilities?
Okay.
So that is why it is still at the level of research. And for now, gene therapy is not available for children less than 12 years. Gene therapy is for 12 years and above.
Okay.
12 years and above.
Okay.
And the cost is prohibitive for most of us here. The cost is in the region of 3-point-something million, maybe like between 2.2 million and 3.6 million.
Naira.
Yes, per person. No, dollars. Dollars. So if you can multiply that cost now, let's say if you use $3.5 million, convert it to naira, how much would that give you?
That's a whole lot of money.
How much would that give you? That will give you like maybe like 7-point-something billion.
So where do one get such
billion
money?
Naira in naira?
Where do one get such money?
So that is the reason why it is not a universally available therapy. It is still at the level of research. When the research has been perfected and people have undergone trial and it has worked for them. But see, science does not just churn out. Once you find a cure, you just churn it out and push it out there. You have to observe the people that have received this treatment and see, are there side effects? Are there long-term complications emanating from this? What is the risk of developing cancer in those who have received this treatment? So science is carrying out this research to see whether it is sustainable. Once it is said to be safe, then it can now be massively deployed. And with government support, the price can drop drastically, can drop significantly, so that more people have it, can afford it.
Okay.
But by and large, the price is still in that region of millions of dollars.
Oh, the price is alarming. Okay, let's take on a quick break now. When we return, we continue. Stay tuned to Challenge Diaries as we go on a quick break.
Nigeria is one of the great nations of Africa, oil-rich, teeming with wildlife, and home to diverse peoples and cultures.
Groups key players to fashion out ways to diversify its economy.
We focus, among others, on education, health, agriculture, politics, environmental issues, and promote development.
Rstv.
We traverse the region for development.
Nigeria is one of the great nations of Africa, oil-rich, teeming with wildlife, and home to diverse peoples and cultures.
Groups key players to fashion out ways to diversify its economy.
We focus, among others, on education, health, agriculture, politics, environmental issues, and promote development.
Rstv.
We traverse the region for development.
Welcome back to Challenge Diaries. You're just tuning in. This is Challenge Diaries. Your setback to come back. Setback. Something has set you back, or something has to bring you back. You have to challenge yourself. Tell yourself, I can do this. I don't like this phrase people say, you can't beat them, join them. I don't want to join them. I want to beat them. if you are there and you think you want to be there, then join me on this ride. I don't take no. And this part of the world where we are today, I don't think no is enough for anybody to see me. That's why I like this wrestler that has this inscription. It's JOSIAH, never give up. So whatever it is, whatever it is, tell yourself, beat your chest and say you can do it. Now, I had to go on that quick break because the money that the doctor was calling almost chokes me. Even if they sell me, I don't know how I'm going to get that kind of money if I was in that situation. So I had to go on a quick break to catch my breath. But welcome back to the program Challenge Diaries. We're discussing with Dr. Josiah, now a pediatrician and head of Department of Pediatrics, Rstv University Teaching Hospital. Now, doctor, I had to catch my breath because when I heard you convert,